Welcome back to Studio 5. Botox injections and surgery can now relieve migraine pain. Dr. Kevin Rose with the Rose Clinic in Provo has joined us to talk about the breakthroughs. Before we explain how it works, explain to me what causes a migraine or what we think causes it.
Well, what we believe is that the headaches are basically triggered by peripheral nerves that are becoming irritated by muscles that surround them around the head and neck area.
So you mentioned muscles, which is actually how Botox comes into play. What do you do then with the Botox to help cure or relieve the pain of the migraine?
So the Botox is specifically injected into trigger sites around the head and neck area, and there happen to be 5 of them. And what it does is it goes in, it paralyzes the muscle temporarily. It lasts for about 3 months. And if the Botox helps, then we know that there is a surgical procedure that we can do that basically mimics what the Botox does chemically.
Now, you mentioned different sites. Now, where would some of these Botox areas be where you would inject the Botox to relax the muscle?
Well, typical areas are between the eyebrows up through here,
this is where someone might, commonplace. Yeah, like if someone sees a bright light or something, like they squint, and those are those muscles that are contracting, and that's what can sometimes trigger a migraine.
Exactly. Another one is in the temple area. There's a nerve that goes through the big chewing muscle there, and so that muscle can be temporarily paralyzed, the anterior half of it. And then lastly is in the back of the neck. There are multiple nerves that are sensory nerves that provide sensation to your scalp that actually go through muscles. And so we're able to inject the Botox directly into the muscle, and it helps take away the migraine pain.
So you inject the Botox in there, it relaxes the muscle or paralyzes the muscle, and that actually helps relieve migraine pain for many people. That actually is just sort of to diagnose it. Is there a next step you can take after that?
Absolutely. If the Botox helps, and it actually only doesn't help in about 11% of patients based on the study that we did with Dr. Guyron in Cleveland. So you have a really good chance that the Botox is going to help you. If it does, then there's a surgery that has a 92% chance of being equally as effective. And so what we do is we can go in and we can remove a portion of the muscle, or if it's a nerve, it depends on which trigger site. So we're basically decompressing nerves around the head and neck region. Is
that going to cause a problem when you remove a nerve or a muscle? It seems like that might limit some of your mobility on your face. Is that going to be an issue?
Well, it's interesting you ask that, because the way that we found out about this whole treatment is in patients where we were trying to make them look better cosmetically by doing forehead rejuvenation procedures. So as a nice side benefit, you actually get a forehead rejuvenation at the same time. And in the back of the neck, there's no cosmetic change back there, of course.
So someone who might have a problem with migraines and actually does the procedure, has the surgery to remove muscles or nerves or whatnot, actually is going to be looking youthful at the same time, sort of a little extra bonus that goes along with it,
a little side benefit.
Yeah. If someone doesn't want the surgery, they say that's a little bit more intrusive than I want, can they continue just to have the Botox treatments to have the same effect?
Absolutely. Just remembering that Botox only lasts for 3 months. There is some hope on the horizon of a potential new Botox, which isn't going to be called Botox, which may last longer, and we have yet to see that, though.
And how did they discover this? Just by doing the forehead rejuvenation, they discovered that the migraines were relieved in a lot of people?
Yeah, it was being discovered in 2 different ways, because people that were injecting Botox were noticing that it was helping headaches, but then also at the same time with these cosmetic forehead rejuvenation procedures, people were also noticing a change.
And I know that people suffer with migraines to varying degrees. How bad should it be for someone before they come into you and say, hey, I want to do some kind of procedure? If someone has a migraine once a year, can they still benefit from this, or it has to be more severe, or what's the gauge there?
Well, I really like to work hand in hand with the family practice doctors, the neurologists, the internal medicine doctors, and I only want to see people that really aren't being helped by medications, or they have significant side effects from the medications, or they just simply don't want to take the medication long term.
And if so, then there really is, as you mentioned, significant proof that a large number of people really will be able to benefit, right?
Absolutely.
Okay. And this isn't all you do down at the Rose Clinic. You actually have lots of other specialties that you do as well, right?
Yeah. I mean, really, breast and body contouring is probably my specialty. I also do many facial rejuvenation procedures, rhinoplasties, eyelid lifts, and that type of thing.
Great. So. It's great. And, of course, you can contact them down at the Rose Clinic. We also want to mention, if you want to get up close and personal, ask them some questions. You can be down at the Utah Valley Women's Expo that's going on this weekend, May 8th and 9th, at the McKay Events Center on the Utah Valley University campus. He's going to be talking about this migraine therapy, as well as some of the other things like plastic and cosmetic surgery. You can also find out more if you go to his website at roseclinic.com. And, of course, we will link you to his website from our website as well. Thanks for letting us know about it this morning.
Thank you very much for having me.